Thank you, Rennie. Hi, everyone. My name's John. I'm a healthcare analyst here at CB Insights. Today, I'll be discussing the future of women's health, touching on key themes, trends, and the types of technologies that we're seeing shape this area. For today's briefing, I'll focus on a core part of women's health, the reproductive system, and the tech innovations that are happening there. But before I start, I did want to quickly point out that women's health isn't just confined to this area, but for the purpose of this briefing, reproductive health will be the main focus. So to get started, I want to highlight the recent boom in activities from tech-enabled startups, really creating these new solutions that are giving women more options and control over their health and well-being. Because this market is relatively early stage, many of these startups are coming out of incubator or accelerator programs. And that's actually been one of the main challenges for a lot of these startups pursuing women's health. Getting funding isn't easy, and this can result from this lack of understanding on where women want to see innovation or where they're willing to spend money on it as consumers. But we are starting to see this process unfold as new product innovation happens across the board. In particular, there's a lot of activity right now in fertility and maternal care. Specifically, this wave of femtech or female technology is really helping shape how women approach their healthcare in general. So why now, and what's really helping drive these innovations? Well, a lot of what's currently happening is a combination of more connected platforms, accessibility, and openness to discussing traditionally uncomfortable or stigmatized topics. So let's take breastfeeding as an example. Now we're seeing these smart breast pumps that connect with mobile apps and provide even more insights to moms than was previously available. And they also have more resources and community forums to learn more about it. And all of this goes back to how there's less of a social stigma that's tied to this topic. So these three drivers have really impacted the space and underlie a lot of the solutions and products that we're going to cover today. So let's take a closer look at some of these topics that have been considered more taboo. And period care is a great example of this. Startups working here are bringing period care into the mainstream conversation, helping get rid of that social stigma that's associated with it. They're bringing this new level of transparency with their ingredients and manufacturing process, giving consumers more knowledge on what's actually going on into making their products. They're also doing this through the online educational content that they're providing, like Lola's blog, for example, and through social impact that's tied to their products. For example, Cora has a global campaign to bring their period products to girls in developing communities around the world and in the US. And another example of an area that's seeing more destigmatization recently is sexual health. Here we're seeing diagnostics play an important role in how women can access these services from the comfort of their own homes. This is especially relevant these days because CDC recently reported that there's been a sharp increase in STIs, sexually transmitted infections, for the fourth year in a row here in the US. And we are starting to see different types of kits that's catering to this need. For example, Ubiome's Smart Chain Kit, which requires a healthcare provider to prescribe the test, tests for low and high risk HPV strains, along with 4 of the most common STIs, while My Lab Box is another startup that's providing a more direct-to-consumer option for specific screenings. Along with destigmatizing topics like period care and sexual health, it's also about creating environments where women can access healthcare without feeling judgment or discomfort. An important part of accessing healthcare as women is being able to find these comfortable spaces to turn to. And that's precisely why we're starting to see these clinics specifically for women's health popping up. Both digital and brick-and-mortar clinics are gaining interest as consumers seek out healthcare that caters to their individual needs and wants, along with the convenience and ease of access to it. Next, we're going to look at fertility, which is currently a huge area of innovation. Fertility is getting a lot of attention with new products and services that are becoming available. everything from tracking one's fertility through mobile apps to new fertility employee benefits. It's an area that's gaining a lot of traction with both investors and consumers alike. A good example of consumer-friendly tech here is fertility or period tracking apps, such as these 4 that's presented on the slide. And this is becoming an increasingly crowded market as more enter the space, and the need to differentiate themselves against competitors becomes an important part to sustaining consumer interest. And some of the ways that they're looking to do this include providing more educational content for engagement purposes, community groups online for more of a support system that's catering to their specific health concerns, and also collecting specific physiological parameters that give more detailed insights. Most recently, a fertility tracking app paired with a basal thermometer was cleared as a digital birth control device. Based on the temperature that's logged each morning, the app's algorithm advises the user to use extra protection during fertile days or not to if she's not fertile. This is a novel method, but it has gotten some scrutiny as far as its efficiency goes. Aside from the digital birth control method, there's also new direct-to-consumer solutions that increase accessibility to contraceptives. Both NERCS and the Pill Club, highlighted on this slide, offer uninsured and insured patients with ways to get home deliveries of these contraceptives without physically going into the doctor's office. It's able to do this via a telemedicine approach to prescribe these medications. So a big pain point for women that want to better understand their fertility or combat infertility is the lack of knowledge that they can leverage themselves to understand, what their hormone levels look like and just where they stand in terms of what options they have in front of them. And this is where new diagnostic solutions are entering the market to meet this demand, with each one offering a different type of service. For example, one will let you test your urine using disposable strips from your home for more accurate fertility insights on a daily basis, while another one tests your genetic risk factors that can cause fertility issues down the road. So far, we've mainly looked at fertility through the consumer lens, but this area could also see more interest from employers and corporates who want to attract or retain talent at their companies. And these startups like Progeny and Carrot Fertility want to work with employers to come up with these benefit plans and services. So when you think of fertility clinics, usually you kind of imagine a sterile lab setting with this very clinical aspect to it. However, this is an image that some of these newer clinics are hoping to change by targeting millennials and younger audiences to seek out fertility services like egg freezing. Clinics like Trellis and Kindbody, they're bringing a wellness component into their fertility clinics. Trellis is even advertising an Insta-worthy studio that comes with a juice bar and a modern workspace. And as you can see, fertility touches on a lot of different innovations within women's health, not just limited to mobile apps, but also going after new employee benefits and clinics. Next, we're going to take a look at what the maternal health space looks like. A lot of the technology, such as connected devices, are targeting both expecting and new moms. In particular, there are now monitoring devices that can track the health of the mom and the fetus. This is a pretty new area, but we are starting to see more of these connected sensors with mobile apps that, can keep track of the frequency of uterine contractions in real time and fetal heartbeats. This is a big implication for communicating with the care team and getting the proper healthcare services when it does become necessary. And actually, maternal health has recently been under scrutiny with the latest statistics on the rise of maternal deaths and childbirth injuries. An investigation into why these rates are rising showed that the lack of safety steps during childbirth by the staff and the lack of close monitoring for extreme blood loss or high blood pressure immediately after the birth were the top contributing reasons. So why are these statistics relevant? 90% of the maternal mortality is due to this extreme blood loss after delivery known as postpartum hemorrhage. and this is creating a need for new solutions that could play a key role here. One example is shown on the slide is a medical device that can be inserted into the uterus after birth that ultimately stops the bleeding. This avoids the need for any type of invasive surgical procedures. So, and even when serious injuries aren't involved during childbirth, the pressure of the growing fetus during the pregnancy and then the actual delivery of the baby stretches and damages the pelvic floor muscles, which help support the uterus, bladder, and bowel. This can cause urinary incontinence, where women can't control their bladder as well, or vaginal prolapse, where pelvic organs start shifting out of their normal positions. This is where pelvic floor trainers come in. Its main purpose is to help strengthen these muscles so that they're able to better support these pelvic organs and allow more control of the bladder as well. And interestingly enough, one of the companies that are developing these pelvic floor trainers, Elvie, recently struck a partnership with UK's National Health Service to provide UK women with these trainers for incontinence. As new moms recover from childbirth and go about their daily lives, breastfeeding is a continuous task for them. And so to make it easier on them and make it a more seamless process that can fit into their hectic schedules, now startups are making these wearable smart breast pumps that women can wear as they go about their day. And these are connected to an application that keep track of metrics like how much milk is being collected and how often, offering more convenience and insights. So as moms transition back to work, the challenge of storing and transporting breast milk puts a strain on them, especially when they have to travel on business trips. And so this is why companies are working to provide either individual or employer plans that provide these storage and shipping services for breast milk. This kind of goes back to my earlier point about how employers could look to fertility benefits and helping retain female talent. This is another example of that. And both of these startups that are highlighted here, Maven and Milkstork, they're working with employers to offer this as a corporate benefit. As women age and transition to menopause and postmenopause, their estrogen levels start declining, which bring about certain symptoms. It can also increase their susceptibility to certain conditions down the road, such as osteoarthritis. And this is an area that doesn't currently have a lot of tech innovations. At the moment, it's more confined to device or drug companies looking to ameliorate certain symptoms that are associated with menopause. And these are a couple of the examples that are pretty early stage in terms of development. Both of these companies shown here on the slide have raised funding last month. Kandi Therapeutics is focusing on reducing these vasomotor symptoms associated with menopause, like hot flashes and night awakenings, while Medora is looking to develop a non-hormonal alternative device to alleviate some of these postmenopausal symptoms. So, although most cancers do affect both women and men, there are some types that are unique to the female physiology, like the female breast cancer and the gynecologic cancers, which involve the female reproductive system. And I'll do a brief overview of what we're seeing in this area. So breast cancer is the #1 cancer that's affecting women today. In fact, female breast cancer accounts for 15.3% of all new cancer cases. And there are a number of startups that are developing easier to access diagnostics options for breast cancer. The iBreast exam device is one example of this, where it can check for non-palpable breast lumps under 10 minutes at a participating doctor's office without the radiation or the high cost that's involved. This could motivate more people, especially within the younger age demographics, to get regular checkups than standard mammograms would. As we saw previously with direct-to-consumer testing kits that test for HPV strains earlier, going after HPV is crucial because it can cause cervical cancer. In fact, 91% of cervical cancer is caused by HPV strains. And while this space isn't full of startups, they are starting to emerge. One example is Antiva Biosciences and its particular drug therapeutic that targets precancerous lesions in the cervix, thereby making the standard treatment of surgery unnecessary. So as seen throughout this briefing, we are making progress that show that while a lot of the product innovation is still new, there is potential for more solutions to be created here that really get to the heart of what women want to see in this market. And we're also starting to see more women-led funds that are investing in women's health startups amongst other women-backed businesses, which looks promising for the market as well. So thank you so much for listening in today, and now we'll open it up to take a couple of questions. Okay, so the first question is, in your opinion, which technologies are the most promising to bring new healthcare solutions? Okay, so I think looking to precision medicine in the context of women's health is really promising. If you think about the wealth of data that's being collected across different apps and devices, there's really this huge potential for understanding what works best for the female physiology in terms of different medication dosages or different medical device designs. Our bodies just work differently structurally, hormonally, etc. So I'd be excited to see data being translated to finding real therapeutic solutions that ultimately will have more impact in general. Okay, and the second question is, what catalyst would be required for investments to increase in the space? I think the main catalyst would be to being able to communicate what the actual needs are in this market with investors that are open to fulfilling that vision as well. You need good products designed by women with women's needs in mind in terms of what would actually be useful versus fulfilling a more short-term need. It would also involve getting more investors on board with the potential for this market and really going after healthcare solutions that will have tangible benefits for women. Okay, and the third question we'll take is, how is the larger wellness movement affecting startups' approach to women's health? I think there's already a huge wellness component to a lot of the products and tools that we're seeing right now. I think it plays a key role in how these products are being designed and marketed for consumers or patients. A good example of this is the new women's health clinics that are incorporating these wellness perks that I mentioned earlier in the briefing. So it's my opinion that we'll see more of this overlap between the two areas, especially as consumers become more conscious of their lifestyle habits from a preventative health angle. Okay, so if I didn't get to your questions today, please feel free to email me and I can try to help answer those. And thank you again for attending.